man won't discuss erectile dysfunction with his friends. He'll talk about baseball, but he's not going to talk about, you think he's going to call up his friend and say, I'm having erection problems? He just doesn't do that.
Thank you so much for joining us again on Second Act TV. So happy to welcome back Dr. Stephen Lamm, renowned men's health, sexual health expert, professor at NYU, and the best-selling author of numerous books, including The Hardness Factor, the topic of our conversation today. Dr. Lamm, thank you so much for joining me again.
My pleasure. Thank you for having me. I think it's an important subject. I'm never going to get tired of talking about this subject because it basically relates to overall health and wellness.
Incidentally, he used to be on The View. They called him in. So I'm just honored that you're here speaking with me and that we can address some of these topics. Today, what I really want to look at, what goes on in the male mind when erectile dysfunction hits, which our audience is dealing with more and more as we get older, of course.
I think that once again, just to redefine erectile dysfunction, it's the consistent inability to achieve and maintain an erection. It's not the occasional inability to achieve. That's physiologic and that's normal. But all of a sudden, a man consistently is having trouble. I can tell you it is devastating for the man. Makes them depressed, makes them anxious. It socially isolates them. For a woman needs to really understand how sensitive a man is about this subject. In how you bring it up as an issue, how you address it in a way that is comfortable and empathic is critical. Men are very sensitive. They need constant validation.
It's interesting that you said that because men are, they're not likely to admit that they want that, which makes it even more difficult to go there.
Well, men are not forthcoming. I mean, when a man comes into my office, they're going to have some sort of physical complaint. They find it easier to talk about. They can say to me, they're having a sleep problem, or they're telling me that they're having some chronic back problems. Or they might tell me that they're fatigued, or they may tell me that they have a libido problem, an interest in sex. They won't come out and say, for example, I'm depressed, right? Mm-hmm. Whereas a woman can go to the doctor and say, Doctor, I'm depressed, I need some help, and it's so much easier. With men, it's like pulling out teeth. I mean, you have to really extract what the real problem is. As I said, unless the doctor is going to address the potential of erectile dysfunction, it may not come up until maybe the very end when they're about to leave. And then are so anxious about it. They say, well, what do you think about Viagra or something like that? When you had an opportunity to talk about it the whole time, but they never brought it up and you didn't bring it up. So a man won't discuss erectile dysfunction with his friends. He'll talk about baseball, but he's not going to talk about, you think he's going to call up his friend and say, I'm having erection problems? He just doesn't do that.
Well, and I think what women really need to understand is, as you say, how devastating that is, that really the feeling or what they're experiencing, and I'm asking you, not telling you, is, am I less of a man? Because their masculinity, as you said in your book, is so closely associated with the hardness of a penis. That's what you're dealing with.
I mean, there's no question that this is part of the most validating sense of their masculinity. And look, they have a relationship with their penis for a long time. They've given names to their penis. I mean, this is very funny stuff. I remember when I was doing research, so there's a very close relationship. And when that member is not working well, it has ramifications. Now, it doesn't mean that they can't be mature enough to overcome those issues and still have an incredibly healthy, intimate, fantastic relationship with their partner. But it's something that you really have to be very well aware of, that it's, as I used the word before, devastating. And the good news is we can fix it. That's even more important. We can literally fix that problem.
Well, I think one of the obstacles that stands in the way of making this conversation easy is that the misinterpretation of what may be going on with the lack of an erection, that women think it's their fault. Men are just, as you say, am I less of a man? What will she think, et cetera, et cetera. But especially that women misinterpret that it's their fault, or that maybe he's having an affair. I mean, do you run
Yeah.
into that a lot?
Yeah. All the time. I mean, women are sensitive about this, no doubt about it. And they're concerned that maybe they are less than less than maximally attractive. And although it can be a factor, I'm not going to say that, maybe 20% of the time or 25% of the time, if a woman is not going to participate and, in the sexual act, it's not going to create an environment that is conducive to having sex. You just can't, go into a room and tell a man, just, have sex with me. I mean, that just doesn't work unless they're 14 years old. Then you don't need to create the atmosphere. Then it just will happen. But most men, as they mature, need an environment. It can't be rushed. It can't be after you've had a major argument. It can't be after you've watched, Fox News or CNN and you're just aggravated. It's just not going to happen, So the atmosphere is really important. There are many different parts of the sexual act that could be a problem. Some men or some women may have trouble with arousal. Some women will have trouble with orgasm. Some women will just have painful sex. You've got to address the female side of this equation. And on the male side, it's not only the erection. Some they can achieve the erection, but can't maintain the erection. Some men can't ejaculate. It's complicated. As I said, I'm amazed that it works most of the time.
You said earlier, I want to follow up with that, that the woman has to participate. Otherwise, even sexual medication or something is not going to work. When you say participate, do you mean just being there mentally, or are you saying touching? Is it the touch
Everything.
that get everything?
Everything. You want to recruit all of the senses. Auditory. You want to talk, all right? You want to touch. You have to participate. You have to recruit as many senses as you can, and it'll be good fun for both of you. But olfactory is really important. Fragrance is really the atmosphere in the room, the fragrance of your body. Those are really important senses.
Yeah, a lot of our audience, as I mentioned to you on the other segment as well, is they're out again in the dating scene after a long absence, meaning they're either widowed or divorced, but they haven't dated in a long time, and some haven't had sex with anybody else in a long time. Since we're speaking about the hardness factor, the hard penis or the lack of it, do you have any advice that you can give of how to handle it if something does happen? I mean, as you said, if you maybe the first time you're having sex with somebody, you're finally there and it's not happening.
I would think that for almost anybody, especially 50 and older, especially if you've not had sex in months or years, you better prepare yourself. You better prepare, because it's going to be anxiety inducing. You have to have a plan. And if the expectation is that you're going to have penetrating sex from the get-go, but rather you're going to just have other forms of intimacy, then I think you work up to the penetration, because it's just not going to happen right away and expect it's going to be satisfying. So I think you have to take time, but I think the stress and the tension is on both parts. The man is worried that he's not going to be able to satisfy the woman because he's read about all these women who have multiple orgasms, and he has an expectation that he can't compete with these other men who this woman has probably had, and so they feel very inadequate. In the end, it's about trust. You have to trust each other. That's not that easy. Well, to trust, you have to talk. You have to develop an intimate relationship. So, like, I had friends who just got married in their late 60s and 70s. So it can happen. It can happen. One of my patients got married and he was 90. So
Oh,
we went to dinner and he
that
was 96. It was great.
hopefully not to a 30-year-old.
No, absolutely not age appropriate.
I'm kidding, but see,
Yeah, no,
I love
absolutely.
hearing that. I absolutely
Of
love hearing that.
course.
I know somebody, one of my friend's mothers, she was so candid. She basically at 90 or something, she bought her first vibrator. It's like, go for it.
Good, go for it.
That's not something that happened earlier. But back to the expectation of penetrative sex. First of all, I think from a women's viewpoint, I will say that not if the penetration isn't necessarily what they want in the first place, and I think if you can talk about maybe redefining what sex is to take the pressure off of men. I
I
mean,
think if
that
you
would
could
be
just,
so
yeah, I
helpful.
agree with you. Just have a conversation. This is what I want. This is what I need. This is what satisfies me. A man would love to know what would satisfy the woman. And if she says, look, this is what I like, this is what I would like you to do, that's fantastic. And I think that, I think it does take the pressure off of the man. But on the other hand, the man may want penetrating sex. So it goes both ways. The one other area that we did talk about, and that's STDs, sexually
Mhm.
transmitted diseases. You've got to understand what the risks are. That's why, condoms are important. Very tough as men get older. I know the fear of pregnancy may not be there. You may not get pregnant, but you could get a sexually transmitted disease. So
Mhm.
STDs are still an area that it's embarrassing to talk about, but you
Right.
got to talk about.
Well, let me ask you something too. I just ask, that I wonder about, and so other people must too. I think, and I'm asking you that men, or I've heard that men will actually lose their erection. Try older men.
100%. That's the
That
problem.
yeah. So,
Yeah.
is there anything else than condoms to deal with STDs?
The reality is that when men get older, they can't put on a condom. They can't sustain an erection because they lose that tactile sensation. And it kind of interrupts the whole act, to stop and to put on a condom. I mean, young men have trouble with this. You
Right.
can imagine older men. What you have to be able to do is maybe get both tested. Once
I was just
you're
going to
going to
ask
be,
you.
you get tested, and then you have the best likelihood of look. We know that people have had multiple sexual encounters. We know that people get STDs. We know that
Mhm.
there are risks, but you
Mhm.
may have to accept the risks.
I always try to dispense, the right advice, if you will. And obviously, you need to prevent yourself from STDs. What happens in the real world is
Yeah, in
something
the real
different
world,
when you're
there's
in
more
the moment.
spontaneity. Right, the spontaneity. That's why you have to have some sort of plan.
Mhm.
Otherwise, you're going to get yourself into trouble. I mean,
Right.
this is true for both males and females. And I think a man would appreciate that a woman is saying, look, I'm worried about STDs. Let's make certain that we have safe sex. That's
Mhm.
going to be a positive statement. No man is
Mhm.
going to criticize a woman for wanting to be safe, because then he's thinking, oh, this is a woman who's thinking, and maybe I'll be safe as well. If I were a female, I would have no problem raising that subject.
Well, then going back to in the moment, or especially when you don't know the person very well, let's say we've been tested, we're safe. What we can do in the moment with the treatments that are available.
I mean, the man knows if he's got a potential issue, and
Mm-hmm.
a lot of men, let's say in their late 50s or early 60s, even if they don't have erectile dysfunction, will very often take a medication anticipating that they're going to have sex and anticipating that they don't want to be in an embarrassing situation, because they want to make that first impression a good one. So a lot of men, even though under normal circumstances where their known partner have no erectile dysfunction, will take a drug like Viagra, Levitra, or Cialis in
Mm-hmm.
anticipation of having sex with a potential partner, not to fail, because they do not want to fail.
Do you think men are well educated about those drugs? I mean, do
I,
they
yeah,
know what to anticipate, what to expect?
I think shockingly that they may need a little education. That's part of the problem. They think that if they take the pill, they get an erection right away. They think the partner has nothing to do with it. No, you have to, and sometimes a man has to take the pill on multiple occasions before they give up. In other words, you take the Viagra, you take Cialis, and it doesn't happen, or you didn't get the erection. You say, oh, I guess it doesn't work. No, you need to have tested the pill multiple times. Early on in my career, when we were talking about the use of these drugs, we would tell a man to practice at home, believe it or not, to test out the pill, to realize their head's not going to explode if they take the pill, and see what happens with some self-stimulation to see that they can achieve the erect. That gives them then the confidence, to engage in a relationship.
I think that's great
Preparation.
advice.
Yeah.
I think that's
We
great
should do that all the
advice.
time.
Yeah.
I mean, what's amazing is we've had this drug for 20 years and we're still talking about it. And that just kind of tells you how important sex is for couples, and how important it is for men, especially.
And how you don't want to talk about it or admit that you need these kinds of drugs.
Yeah. And also, you shouldn't, shouldn't have expectations of being able to, when you're 50 or 60 or 70, to perform the same way that you did when you're 20. You probably can perform better because you're more mature and you're more experienced and you have more sensitivity.
One thing that I want to clarify again as well is we keep telling women it's not your fault that this is happening. How true is that? Because women blame themselves all the time.
Yeah, well, we certainly don't want them to feel responsible for their partner's erection, but you have to participate. You can participate by creating an environment that is conducive, that's not rushed, that's calming. I guarantee you, the woman is not the primary reason why men have erectile dysfunction.
Well, in your years, of course, as a men's health expert, as a sexual health expert, again, you've seen a lot, you've done a lot. What do you wish that men would understand or women would understand? When I ask that question, does anything come to mind?
Sure, communication. Some fundamental needs. I think men fundamentally need sex, believe it or not, and fundamentally need validation. I think women need security. They need intimacy. The relationship is better. Relationship is really, really important. And as I said, it's not that the man doesn't find his partner attractive or not attractive. That's really the least of the. I really think that's lower on the scale than the communication, the trust, the empathy. That's more important. I mean, a man can't be responsible for a woman's who has a low libido unless he's responsible for her low libido because he's an idiot, But this is what, by the way, this is how I talk to the patients. It's very straightforward. Yeah. Love it. The men love it.
I thank you so much for joining me today, and just to, for raising some more awareness around this very, very important topic. And I will link to your book, The Hardness Factor. It's been out for a while, and it absolutely has amazing information that I think both men and women, will really appreciate knowing. It's one-stop shop about your hard penis. Dr. Lamm, we're very lucky to have you here, and I look forward to our next conversation on Second Act TV.